Welcome. You probably know I'm Dr. Mehmet Oz, Administrator for the Centers of Medicare and Medicaid Services. Today, I want to talk about CMS's continuing efforts to reduce the cost of prescription drugs in Medicare Part D through the Medicare Drug Price Negotiation Program. You all know about it. It's a key part of delivering our mission under President Trump and Secretary Kennedy to make America healthy again. And you're aware, on January the 1st, 2026, new prices will come into effect in Medicare Part D for 10 prescription drugs. Now, we're hard at work negotiating prices on another 15 prescription drugs to help Medicare beneficiaries. That's why I'm so excited to announce the upcoming launch of the Medicare Transaction Facilitator, or MTF. It's going to play a key role in making our newly negotiated maximum fair prices available to beneficiaries at pharmacy counters all across America. Listen, my grandfather was a pharmacist. My wife's grandfather was a pharmacist. I know how important pharmacies are to the fabric of our society. They're not just pill dispensers. CMS recognizes the pharmacy community is a critical partner in successfully implementing the new drug prices. We also understand that these new prices will bring about operational changes in reimbursement practices for pharmacies dispensing these drugs under Medicare Part D. The MTF will create an essential connection between drug manufacturers and pharmacies, as it provides an avenue for pharmacies to receive reimbursement payments from drug manufacturers. Enrolling in and using the MTF is free for pharmacies, and I encourage you to take the straightforward steps discussed in this presentation and enroll in the MTF as soon as possible. Our team at CMS is here to help you. We're committed to a smooth transition and successful implementation, and we urge you to take advantage of the many resources we'll talk about during today's session. We're excited about this next step in the negotiation program. We're listening to your feedback. We appreciate your ongoing engagement, and we're proud to work alongside you as we bring down the cost of prescription drugs. Thank you all for joining us today and for the important work you do to keep America healthy. I'll now turn it over to the team to share more information about the MTF and the upcoming enrollment process.
All right, great. Thank you, Dr. Oz, for the introduction. We're excited to be here today for the initial launch of the Medicare Transaction Facilitator. Welcome, everyone. Thank you for taking the time to come hear about this new system and the importance of enrolling your pharmacy in this system. I'm Brennan Folsom. I'm the director of our Division of Manufacturer Compliance and Oversight in the Medicare Drug Rebate and Negotiations Group. I'm joined today by my colleague, Mike, who I'll pass it over to now for a quick introduction. Mike?
Yeah, thanks, Brennan. I'm Mike McCormick. I'm the director of the Division of Manufacturer Data and Inflation Rebate Operations in the Medicare Drug Rebate Negotiations Group.
So before we jump into our presentation for today, I want to just take a quick note of the following disclaimer. The information provided in this presentation is intended only as general, informal summary of technical legal standards or operational processes. It is not intended to take the place of the statutes, regulations, the formal policy guidance that is based upon. This presentation summarizes current policy and operations as of the date it was presented. Links to certain source documents have been provided for your reference. We encourage attendees to refer to applicable statutes, final guidance, and other interpretive materials for complete and current information about the requirements to apply to them. And with that, let me talk us through our agenda briefly for today's session. As we're moving forward with the full implementation of the Medicare Drug Price Negotiation Program and effectuating those maximum fair prices that have been negotiated as a result of this program, we are really focused and committed to helping pharmacies navigate that implementation and have access to the tools necessary to ensure that the program does not disrupt any ability to continue serving your patients. So to that end, as we're digging into discussion about the new Medicare Transaction Facilitator, or the MTF system we're developing to help effectuate those negotiated fair prices. We're going to talk today on some general background with the program and of the MTF, its operations, but the primary focus of today's session really is on enrollment processes. So we'll talk through those processes. We'll do an enrollment demonstration that shows how to navigate the system through enrollment if you are coming in as a pharmacy, how to get signed up and onboarded into the system. And then we'll, of course, also highlight some help desk and other resources that will be available and are currently available to both prepare for enrollment and to use as you're going through the enrollment process as well. Of course, we'll save some time at the end to address some questions to make sure that those get squared away too. And with that, I'm just going to go ahead and jump right in to some background about the program. So we'll start off with just a general introduction of the negotiation program. I think many of you are familiar with that already, but just to help set the stage, The negotiation program, it requires that Medicare beneficiaries covered under Part D are going to pay no more than the negotiated maximum fair price, or MFP, for a selected drug once that MFP is effectuated. This essentially means that the plans that reimburse pharmacies after dispensing these drugs will be reimbursed at the rate of the negotiated maximum fair price, or no more than that rate. As many of you know, last year we, as CMS and drug manufacturers, negotiated 10 selected drugs under this new program. Those negotiated maximum fair prices are set to take effect on January 1st, 2026. We're also currently working on the next 15 drugs negotiations. Those will take place in 2027. As I mentioned, because of the way that the plan reimbursement is going to work after those effectuation dates, CMS recognizes that it's likely that pharmacies are paying more to acquire those drugs than they will receive in reimbursement. That is where the MTF comes in. CMS is setting up this system to connect manufacturers and dispensing entities to help facilitate any refund processes that need to be to accompany the reimbursement you're receiving from the plan. And of course, to be ready for January 1st, 2026, the first step is enrolling and signing up for the MTF. It's important to note, signing up for the MTF is not a commitment to anything broader in Part D. It's not a commitment to dispense Part D drugs broadly or to dispense these selected drugs with negotiated maximum fair prices specifically. It is purely just signing up for this tool that will be available if and when you need it. Once you enroll, that's the only action that as a pharmacy you need to take. Then as soon as you were to dispense any of these drugs on or after January 1st, 2026, the MTF will be available in the background to run its process and to make sure you have access to the tools you need to continue your operations. With that, let me talk a little bit just about background on what the MTF is itself. So the MTF is set up in two modules. We have an MTF data module and an MTF payment module. On the pharmacy perspective, you'll really experience this as a single system. You'll hear us talk often about the MTF system. Mostly that will refer to the MTF DM from the pharmacy perspective. The MTF PM will operate in the background. You'll interface only with the DM. What does this system do? It's positioned to connect both a data exchange and a payment exchange between drug manufacturers with these negotiated drugs and the pharmacies dispensing those drugs under Medicare Part D. It does that by collecting data from the claims flow that you already put in during your normal operating practices. Every time you fill a Part D claim, we will absorb that claims data flow and pass it to manufacturers to give them the information they need about what drugs need MFP to be effectuated and to what pharmacies. The manufacturers then exchange data back with the MTF to provide instructions on what the MTF should do to potentially make MFP refund payments to pharmacies, for example. And should they choose to use the payment functionality, the system will also then directly facilitate the refund payment back to your pharmacy. This will, again, all happen somewhat passively behind the scenes as soon as you are enrolled, although you will have access to some tools within the MTF data module's user interface that we'll talk about shortly as well. So generally wanted to cover the basics of the MTF. Let me talk a little bit next about the general functions of the MTF data module and what the MTF data module will allow dispensing entities to do. During the enrollment process, this is all prior to January. This is where we're here to launch enrollment today, and it will continue through the rest of this year. There are a variety of things that the system is set up to make a straightforward, streamlined process for pharmacies to get signed up and ready to go for January. You'll find these all in the enrollment user interface and in an enrollment form that you'll fill out while going through the enrollment process. But this includes things like self-identifying any material cash flow concerns that you're worried about with the transition between reimbursement entirely from the plan to reimbursement shared between the plan and the manufacturer refunds. You're going to have access to helpful information about using the MTF, how to assign user roles, how to navigate the system, how to navigate the enrollment process itself, as well as how to navigate reports and things like that may be useful for you in the future as your operations continue. We built the system to allow you to leverage existing data sources from the National Council of Prescription Drug Programs, or the NCPDP data. We recognize that many, if not all of you, have profiles in NCPDP that collects a lot of the similar information we need to operate the MTF. You'll be presented with an opportunity to authorize the use of that data in the MTF system, which will allow us to port that data straight into your profile, and you'll be able to review it there. during the enrollment process. This will save a lot of manual entry, but make sure that all the data matches and is up to date and where we need it to be. You'll also have an opportunity to direct the way you would like to receive any MFP refund payments and the accompanying remittance advices. This could come directly to your pharmacy. These can be linked to a third-party support entity, or TPSE as we refer to them as. These are things like the Pharmacy Service Administrative Organizations. If that is something you're using in your current operations today, that will be available in the MTF, and there'll be a process for you to be able to link that directly to where you need to link it, to your payments, and your remittance advices end up where you want them to be. And then during the enrollment process, you'll be able to review the MTF-DM user agreements. We'll talk about this a little bit more later, but importantly, just outlines the roles and responsibilities to make sure that we can successfully and sustainably operate the MTF and continue for this tool to be available to you. During the implementation of the MFP, so this is from January 2026 going forward, and as the first 10 drugs starting in January, adding new drugs each year after that, the data module will also provide some useful services that will be available to you. Again, this can be passively used, but are available to your needs. So, first and foremost, it's going to facilitate those refund payments from manufacturers who have chosen to use the MTF payment module. This will happen. The payments will come to where you have directed them during your enrollment process. Can be kept up to date over time and shifted as needed. But again, a major function here is behind the scenes. After you have filled a prescription of a selected drug, the system will help make sure that refund payment makes it to you. It also will facilitate you receiving the remittance for the payments that are made. This will be in the standard X12 835 format. And should, ideally match with your standard operations as well. We've been careful to try to make this as seamlessly integrated as possible. And we have some resources about the 835s as well that will be useful as we're gearing up. You'll be able to have access to a portal to submit complaints and disputes. This is anything that comes up during MFP effectuation that you're concerned about. Lack of MFP availability, for example, or data disputes. There'll be an avenue for you to submit those directly to CMS for review. We'll have a variety of reporting features for dispensing entities and pharmacies in the module. This will allow you to see things like the status of payments or the status of claims as they're tracking through the system. Again, so that it's transparent and predictable with how it's coming back your way after those dispenses. And of course, you'll have the ability to manage users for your own organization. That won't need to go through CMS or any other third party. You'll be able to directly invite new users, assign them user roles, and keep your profile information up to date. So that should really enhance the usability of the system. So that's a general overview of the program that's coming, the structure of the MTF, and the benefits that it will bring to pharmacies as we're getting into MFP effectuation. I'm going to pass it back over to Mike now and get into some of the weeds of the enrollment processes themselves, and leading up into our demo. So Mike, why don't you take it away?
Yep. Thanks, Brennan. Appreciate that. So now that we've gone over some of the basics of the MTF, we'll discuss how dispensing entities can enroll in the MTF. So MTF enrollment will launch on June 9th, 2025. At this point, dispensing entities will be able to enroll in the module. So CMS will send enrollment invitations to points of contact listed for dispensing entities and their third-party support entities. We will get this information and these points of contact through the National Council of Prescription Drug Programs, or NCPDP's DataQ pharmacy database. And this database is also referred to as the NCPDP pharmacy database. So that's where we'll be getting the points of contact that we will send these specific invitations to. And these invitations will be sent on a rolling basis over the month of June. So if you don't receive an invitation the first week or on June 9th, don't panic. We will be sending these on a rolling basis. And if you have any questions, you can reach out to us for support or assistance. After you come into the module, one of the first pieces you'll have to fill out is the MTF data module user agreement. So because the system will house sensitive information like claims data, financial information, and because we'll collect critical information regarding banking information to process payments, each organization using this MTF-DM will need to enter an MTF-DM user agreement. This agreement will also establish requirements for safeguarding sensitive information and for interacting and interfacing with the MTF system. So this user agreement outlines responsibilities of each party that will be engaged in the MTF, including CMS, our contractors, and all MTF users. And we just want to note again that this user agreement covers only the access to the MTF DM system. The user agreement is fully independent for any other contracts or agreements a dispensing entity may have related to their participation in Medicare Part D. So essentially terms and conditions like you would see in any other website that you would have to sign up for. So after you sign the MTF user agreement, the next part of the system that you'll encounter is the MTF DM enrollment form. This is designed to collect the necessary information the dispensing entity and a third-party support entity will need to enroll in the MTF DM. Completing this form in the UI or user interface will result in the ability to secure access to the MTF DM, electing preference for receiving MFP refund payments from participating primary manufacturers, accessing reports due to their MFP eligible claims, and when necessary, like Brennan said, filing a complaint or a dispute. Some of this functionality is not available yet, but will be available in the module over the coming months. And please note that each dispensing entity enrolling in the MTF DM will only need to complete this form once, but this will need to stay up to date over time. So if there's information that changes, these organizations will be responsible for keeping that up to date in the MTF DM system. So next, we're going to go over a slide regarding dispensing entities and third-party support entities. We've received a lot of questions here, and we just want to make it clear that dispensing entities and third-party support entities will each need to enroll in the MTF separately. There will be a third-party support entity questionnaire and a dispensing entity questionnaire upon enrollment. So as part of the enrollment, dispensing entities will need to identify if any relevant third-party support entities they're planning to work with when they fill out their dispensing entity enrollment questionnaire. And dispensing entities will also need to determine their preferences for receiving MFP refunds, processing electronic remittance advice, or paper remittance. Third-party support entities will separately need to complete a enrollment questionnaire and should not complete anything on behalf of the dispensing entity. So each entity will need to separately enroll, and then the dispensing entity will basically have the ability to select a third-party support entity that will link them in the system. Again, as Brennan mentioned, we are utilizing this NCPDP database as our source of truth for the module. So during enrollment, because we're importing this information from the database, you will have the option to authorize the MTF DM to use the data from the NCPDP DataQ pharmacy database. And if you do authorize this access, the MTF DM will automatically match your enrollment to the NCPDP data using key fields you provide. This includes legal business name, doing business as name, NCPDP relationship ID for chains, or NCPDP provider ID for non-chains. So authorizing the use of this data will enable the MTF to import this information, such as name, address or addresses, national provider identifier, and tax identification number into the enrollment form for your review and verification. So it essentially just tries to make the process a little bit easier, imports information, and allows you to verify instead of having you have to fill out everything at the time of enrollment. This will also allow you to have the ability to select a third-party support entity if you indicate during enrollment you're using a third-party support entity to help process your MFP refund payments and or electronic remittance or remittance advice on your behalf. If you do not authorize the MTF DM to pull this information on your behalf, that's okay, but you will need to manually enter or upload the information necessary to the MTF DM directly during enrollment. So again, because of this NCPDP database as a source of truth and the syncing option that we're providing, we really do encourage all dispensing entities, especially ones that plan to pre-populate this information, to upload your information and update your information in the NCPDP database as soon as possible. And we recommend at least 2 weeks before beginning the enrollment process. We're getting direct feeds from the NCPDP database, but there is some lag that takes place. So we just want to make sure that everything is up to date and refreshed before you attempt to enter your enrollment. And we also want to note that all dispensing entities should ensure the authorized official or main point of contact in this NCPDP pharmacy database is up to date, noting that changes, again, will not immediately populate during enrollment. There's a little bit of a lag, but you can do this by updating your information in the NCPDP Access Online. And if you have any questions on that, you can reach out to NCPDP or our email address for assistance there. So at this point, I'm going to turn over the presentation to our contracting colleagues at DCCA for an enrollment demo of the MTF data module.
Welcome to the Medicare Transaction Facilitator data module, also known as MTF-DM, Enrollment Before You Start video. Please note the disclaimer on the screen. The agenda for this video will cover the following. 1, we will cover the Before You Start information. 2, we will go through the dispensing entities need to enroll. Next, we'll cover the third-party support entities need to enroll. And next, we'll cover the drug manufacturers need to enroll. And finally, CMS contact information. Before you start, there are 2 main steps for this enrollment process. 1, you'll be creating and verifying your account as a first user for your organization. 2, enrolling your organization in MTF. The workflow is shown in the following figure. The first box shows receiving an email invite to enroll in MTF as the first user for your organization. The next is a question. Do you have CMS ID credentials? So CMS ID credentials here refers to a CMS IDM enterprise credential. This is different from an EUA credential. So if you have one of these, then you can simply log on to MTF using these credentials and set up your account, and you'll be able to enroll your organization in MTF. If you don't, simply create an account with new user registration, and you'll be logged onto MTF after this account setup, and you'll be able to enroll your organization in MTF. Once you have your account and you are ready to enroll, see the following sections for the information you will need to have available. Lastly, the enrollment process should take you about an hour, about 5 minutes to activate your user account, and then about 40 to 60 minutes to enroll your organization. For dispensing entities and what you need to enroll, first you will need to verify your NCPDP data. The information that is contained in the NCPDP pharmacy database for your organization at the time of enrollment is what the MTF will rely upon to both 1, identify and validate you as a first user, 2, pre-populate certain fields in the dispensing entity enrollment questionnaire if permitted by your dispensing entity. Please ensure this information is up to date prior to beginning the enrollment process. You can also update your organization's information via the NCPDP website at https://sso.ncpdp.org. Also needed for dispensing entities to enroll are the following pieces of information. So verify the following organization information in the NCPDP pharmacy database: legal business name, DBA name, store location number, mailing address, business address, your NCPDP provider ID, parent organization ID, relationship ID, your NPI, your state license number, and your federal tax identification number. Finally, for dispensing entities, once you have your NCPDP data updated, you receive your invitation and you are ready to enroll. Have this information handy. 1, a list of your NPIs for which you anticipated material cash flow concerns apply and the associated concerns. 2, information regarding MFP refund payments and or ERAs or remittance advice sent and made available to a TPSE. And finally, the financial information and contact information. For TPSEs, otherwise known as third-party support entities, you will need to verify your NCPDP data, The information that is contained in the NCPDP pharmacy database for your organization at the time of enrollment is what the MTF will rely upon to both 1. Identify and validate you as a first user, 2. Pre-populate certain fields in the dispensing entity enrollment questionnaire if permitted by your dispensing entity. Please ensure this information is up to date prior to beginning the enrollment process. You can update your organization's information via the NCPDP website at https://sso.ncpdp.org. Next, for TPSEs, please verify the following organization information in the NCPDP pharmacy database: legal business name, DBA name, mailing address, business address, federal tax identification number, payment center name and ID, remit and reconciliation name and ID, relationship name and ID. Also, you will need contact information for your primary and secondary contacts. For drug manufacturers needing to enroll, you will need the following from the program agreement: selected drugs for which the manufacturer is the primary manufacturer and holds the negotiation program agreements. 2. Date each drug added to the agreement. And 3. Date each drug terminated from the agreement. For manufacturers, you will also need if your organization will use the MTF PM to pay retrospective reimbursements to dispensing entities. You will need 1. Financial institution information, and 2. The manufacturer point of contact. As a manufacturer enrolling, you will also need payment details, such as your bank account routing number, your depositor account number, your registered financial account type. 2. You will need a voided check or signed bank letter. 3. You'll need a signed copy of your organization's effectuation plan to upload. And 4. You'll need a signed copy of the MTF payment module agreement to upload. Please note that all of these uploads are required in the PDF format. If you need help at any time in completing the enrollment process, please contact CMS at MFP Medicare Transaction Facilitator at cms.hhs.gov. Welcome to the Medicare Transaction Facilitator Data Module, also known as MTF-DM, How to Access the MTF-DM System video. This video is for all user types. Please note the disclaimer on the screen. The system roles available for both manufacturer, DE, and TPSE roles are the following. There is a role for an authorized signatory official, an access manager, and staff end users. The ASO and AM roles both have the ability to invite additional users to the system. There is a concept of first user into the system, where the first user must associate to organizations for DEs and TPSE users. This slide is specifically for manufacturers. If you are a manufacturer, you will receive an email invitation for the MTF-DM system for an authorized signatory official role. Please click on the registration link within the email and create or use an existing CMS IDM account credential to continue the process. If you are new and do not have an IDM account, please enter in your personal details to create a new account using new user registration. As part of the process, you will authenticate with your account to begin your CMS IDM Remote Identity Proofing RIDP process. Automated RIDP is handled transparently using an Experian service. This RIDP process will validate your personal details to verify who you say you are to use this system. Once you are validated, you are verified to use the MTF-DM. If you are a dispensing entity or third-party support entities, your registration steps are slightly different. You will first browse to the URL https://mtf.cms.gov, and you will register as a first user. Any subsequent users for DE and TPSE user types can be invited by this first user within MTF-DM to avoid the organization association step. Invited users, please click on the registration link within the email and create or use an existing CMS IDM account. For both first users and invited users, you will need to enter in your personal details to create a new account if you don't have one already. You will need to go into Authenticate with your account to begin the CMS IDM remote identity proofing process. The automated RIDP is handled transparently using Experian as a service. This will verify your personal details that you have entered to verify who you say you are. If you are a first user, you must enroll your organization using the workflow on the screen. The remote identity proofing process looks as the screenshots portray on this slide. You will first be asked to view the terms and conditions, and then you will be asked to provide your personal information. This is your legal first name, last name, your date of birth, your social security number, your personal email address, your home address, your city, state, and zip, as well as your personal phone number. This information will be used to match against the data that Experian has to verify who you say you are as you have entered into this form. RIDP is required from a security perspective for a FSMA moderate system that handles financial information, PII, and PHI. MTF-DM is a FSMA moderate system. If you are a DE or TPSE user and you are a first user, after you have completed the RIDP step, you will be directed to create your profile. Please note that your name that you are registering with must match with what is in the NCPDP database. Once you continue, you will be presented with the first step where you select an email address. So this email address will be based on your name match, and it will show you any names that match and email addresses. Please select the one that is applicable to you. Once you select it, a link will be sent to your email address to verify your email address. Then you will have the ability to add organizations to add to your profile. Please note that you may add one organization at a time. You will also be able to edit this organization within the MTF-DM's system at a later time as well. Please note the screenshot from the registration process for organization association. You'll be able to associate as well as finalize your organization choices here. If you have any questions in completing this process, please email CMS at MFP Medicare Transaction Facilitator at cms.hhs.gov.
Welcome to the demo for dispensing entities who are enrolling in the Medicare Transaction Facilitator, or MTF for short. Once you have logged in with the user ID and password you created, you will be on the MTF welcome page. This page contains helpful information related to enrollment, such as resource documents, enrollment timeline, help desk, contact us, sign up for emails. You'll also see a help desk link at the top of the page, my account, and logout. The help desk link will provide you with phone and email. My account will bring you to your MTF profile. This is where you can manage your MTF profile and also your CMS IDM by clicking on Manage Profile Settings. This opens a new tab where you're able to update your personal and business contact information. You can change your password and you can change your security questions. Once you're done here, you can simply close out of the tab and you're back at your MTF profile. Again, this contains information related to your user ID, your role, and your status. It also contains your work email and the organizations that you're associated with. If you're associated with multiple, this dropdown will show you all of them. You can also click on the Administration tab at the top, and this will bring you to Search Users, Invite Users if you're an ASO or an Access Manager, and Search Invitations if you want to see who's already been invited. When you click on the DETPSE Enrollment tab, you're brought to the Dispensing Entity Enrollment landing page. This is where you will begin your enrollment. You select the DE profile. Again, if you're associated to multiple in the dropdown, you will see all of them. I'm only associated to one, so that's all I can do. Next, you will begin with your agreement. As an ASO, you are the only one authorized to sign the agreement. If you are not an ASO and you're an Access Manager or a staff end user, you will need to wait for your ASO to complete this section. Once that is done, then the complete enrollment form will be enabled. The enrollment form is able to be filled out by your ASO or your Access Manager. To sign the Dispensing Entity Agreement, you must be an ASO. If you're not an ASO, the View Agreement button here will be disabled. I'm an ASO, so I can come in and I can view the agreement. And you can scroll through this modal, just explaining what the agreement is. And you will need to fill in some information. You will need to put in your signature, your title, the name of your dispensing entity, your address information, address line 1, address line 2 if you have a second address line, your city, your state, and select from the dropdown, your zip code. The system will automatically put the date and time in for you. You continue to scroll, you'll see that there is an Exhibit A as well. Just more information for you to read. Once you're done, you simply click the Submit button. If you would like to print, you click the Print button, and it will open a window where you're able to print, which is Download. You can save that information to your desktop. And you'll have it for future reference. Once you're done, close out, and you'll be brought back to the landing page. Now you can see under Sign Agreement is completed, and any user can view it. So again, they can click View, and they will be able to see the entire agreement, who signed it, on what day, and what the agreement contains. They'll also be able to print it and save it. Simply close out of there, and now the ASO or the Access Manager can begin the enrollment form. The Dispensing Entity Enrollment Form should take less than an hour to complete. The authorized signatory official and Access Manager are authorized to complete the enrollment form and certify. Staff end users will be able to view the enrollment form once it's been started and after it has been certified. Once you are ready to begin the enrollment form, click on the Begin Enrollment Form button. You are now in the Dispensing Entity Enrollment Form. You will see here at the top, it says Dispensing Entity Enrollment. And here will be your organization name. You will also see the status as in progress. To the left, you'll see all of the sections that will need to be completed and all of the questions within each section. You do not need to go in section order, but you do need to complete each section before you can certify your enrollment. Please ensure you click Save on each page to save your responses. Here you are in Section 1, MTF DM User Roles. If you are an ASO or an Access Manager, you can click Manage Users within your dispensing entity, and you will be brought to the Administration tab. This section is purely informational. It shows the list of dispensing entity users associated with this dispensing entity, their user role, their full name, and their email address. Click Save when you are ready to move to the next section. Section 2 of Dispensing Entity Enrollment is your identification information. After you have read the instructions page, click Save, and you will be asked if you would like to use NCPDP Data Queue to pre-populate your information. If you select No, you'll proceed to have to manually enter your location information. Simply click Add Location, and you can enter all of your information here on the screen. The system will let you know any fields that are required, and it will not let you add it if you do not enter all of the information. Or you can download a template which contains all of the information you see at the top in an Excel spreadsheet. You can fill out the Excel spreadsheet, come back here, and upload the file, and it will populate the table for you. If you instead would like to have your information pre-populated, simply select Yes. It is now asking you to just confirm your information. Once you confirm this information, it will let you know the confirmation is complete and you can move on. If the information shown here is not correct, you either need to go back to NCPDP and update your information or select No to enter it manually or to use the Excel spreadsheet. Once you click Save, you'll see that the information is populated here for you. Every field has been entered where applicable. You can click Save and move to the next question. Here, the system is asking you if you have any dispensing entities self-identifying with anticipated material cash flow concerns. You can select I prefer not to answer or no, and simply be able to move on. If you select yes, you will need to enter the NPIs that have the material cash flows concerns. You can also download a template to enter multiple NPI numbers and then upload that file here. Either way, once you are done, click Save and you can move on. That will bring you into the next section. Section 3 of Dispensing Entity Enrollment is financial information. Once you have read the instructions page, click Save and you'll be brought to question 1. This question is asking if you want to use third-party support entity listed in NCPDP Data Queue to process your MFP refund payments. You can select yes or no. If you select no, you can move on by clicking Save. If you select yes, a list of your current active associated entities is provided. You can choose from one of these by clicking on the Select button, or you can look at all TPSEs in NCPDP by clicking this box here. And all entities will be returned. You can filter on any of these columns. So if you looking for someone specific, you can start typing in the name. So here, if I was looking for festivals and I clicked in the F, typed in the F, you can see any of them are coming up. I can select this one. And if I do select from this list, it will provide the information down below so that you know which one you have selected. If you decide you do not want to use this after all, you can uncheck the box and it will bring you back to your associated entities, and you can select from this list. Once you have made your selection, click Save to move to the next question. The next question is asking if you want to use third-party support entities listed in NCPDP data queue to process your ERA remittance advice. You can simply click no and move on, or again, select yes, and you will see a list of your active associated entities. You can select one of these, or again, you can choose from all TPSEs in NCPDP. Same functionality as the previous screen, where you can filter on all of the columns and select one of these. I'm going to select one, and the system is just saying you have elected to use an entity outside of your current relationship setup. Please ensure this is correct. And here's the entity that you have selected. Click Save, and you move to the next page. Now you're being asked that the dispensing entity and the third-party entity have mutually agreed that the third-party support entity named will act on the dispensing entity's behalf in the specified manner. Click Yes and Save. Now you need to provide your dispensing entity's refund payment preference. From here, you can choose electronic transfer of funds or paper checks. When you select electronic transfer of funds, the information you need to provide is displayed. You will need to fill in all of your banking information, including your account number and routing number, your tax ID number, your NPI, and your address information. You will also need to upload a voided check or a letter from your bank with your account information. If you select paper check, you will need to enter your federal tax identification number, your NPI, and address information. I'm going to select electronic transfer of funds, and I'm going to put in the information. Bank account type, you select from checking or savings. Enter your bank account information. Re-enter your bank account information. You must do this one by hand. You cannot copy and paste in here, and these will be checked to ensure they are the same. And enter in your routing information. Again, you will not be able to copy and paste. You will have to enter this in manually. Enter your tax ID number, your NPI, and you can see I put in invalid, so it's letting me know that I must enter a valid format. Enter your dispensing entity's NPI and your address information. Once you have added in your information, click Save. There you go. Click Save, and this is where you will need to upload a financial document. So this will be a voided check or a letter from your bank. Simply come to here, upload your file, select your file. Now your upload is complete. You can download a copy of this voided check. You can delete it if you wish to enter a different one. But once you are done, click Save, and you're on question 2. This again is just wanting you to acknowledge that your third-party support entity will receive your MFP refunds or the ERA remittance advice on your behalf. This is what you had selected earlier for your TPSEs. So click that you acknowledge and agree and save. The last question here is asking if the dispensing entity is a nonprofit organization. Simply answer yes or no and click Save. Section 4 of Dispensing Entity Enrollment is MFP refund payment instructions for primary manufacturers who are not participating in the MTF payment module. Once you have read the instructions, save, and you are brought to question 1. Question 1 is asking you to acknowledge that financial information will be shared with primary manufacturers that are not utilizing the MTF payment module. Question 2 is asking you to confirm the TPSEs you have chosen for your MFP refund payments and/or remittance advice. These are the selections you chose in Section 3, Questions 1 and 1A. If you chose not to use a TPSE for either, they will be grayed out. So as you can see, these are grayed out. I did not make a selection for remittance advice. I did make a selection for refund payments, so I need to enter the information here. If you do not remember your selection, you can go back to question 1. Nothing will be saved on this page, so don't fill anything out until you have all of your information. So if you need to go back, simply go back to question 1 and note who you chose, the name, and the relationship code. And then you can return to section 4 to enter the information. Again, since you are not saving until you're done, if you go back and forth, your selections will be removed each time. So make sure you have all the information you need, enter that in. You can acknowledge and agree, and then you can move on and save. If at this time you decide you do want to use a third-party support entity, you can go back to question 1A and select one, and this will be enabled. Again, be mindful that when you leave this page, you will lose the information that you have put in. Until you click Save, nothing will be saved. You can now go back. Your information is saved, and then you can change your third party for payments or for remittance. Until you certify, you can change this as many times as you want. Once you are set with your information, again, you can move on. Section 5 of Dispensing Entity Enrollment is your contact information. After you've read the instructions page, click Save and enter your primary point of contact and your secondary point of contact. You'll need to enter in first name, last name, title, email address, and phone number. A second phone number is optional. The same information is required from a secondary point of contact. Enter their first name, last name, title, email address, and at least one phone number. Once you have entered the information, you can simply click Save to go to the next section. Section 6 is Dispensing Entity Certification. Upon entering Section 6, the system will perform a check to ensure all sections and questions have been answered. If there are any items that need to be addressed, they will be displayed on the screen for you to take action. If everything passes, the status at the top of the page will say Ready for Certification. So you can see this one has passed all of the checks. You can also see here in your table of contents that you've completed 5 of 6 sections. All of the sections have green check marks next to them, indicating that they have been successfully completed. Once you have read the instructions, save, and you are brought to the certification page. First, the authorized signatory official or access manager must certify the information provided in this enrollment form is complete and accurate. Upon clicking Yes, you are now able to enter your name and the date. The only date you will be able to choose is the current date. Once you have entered your information, click Certify, and you have now completed your dispensing entity enrollment.
Okay, thank you, DCCA. Now we just want to jump back in and go into some help desk support and resources that we have. So MTF Help Desk, we have recently established a dedicated support number for users of the MTF, which will be available 7 o'clock a.m. to 7:30 p.m. Eastern Standard Time, Monday through Friday, excluding federal holidays. This resource will be available when the module first goes live on June 9th. This help desk can support with the resolving a variety of issues, including user access, navigating the MTF, addressing inquiries related to reports, files, and data exchanges in the future when that functionality is available, and also just kind of assisting with general enrollment questions as you get into the system for the first time. After-hours calls that are received via voicemail can be triaged and will be listened to and responded to in the next business day. So our number here is 877-MTF4HLP. And again, our email address to, in case you have a different inquiry or have another question or want to reach out via email, It's MFP Medicare Transaction Facilitator at cms.hhs.gov. We also want to reiterate a great resource that we have, this Pharmacy and Dispensing Entity Resources page on cms.gov. This is a great resource where we post all of our latest public-facing content. You can visit this page, just to prepare for January 1, 2026. Even after you've enrolled in the MTF, there's a lot of great resources here, and will be more as we continue to push out new functionality to the system. We have FAQs, frequently asked questions, that are available now, and we're constantly updating them over time on this website. And there's also the ability to sign up for the MTF listserv. If you do this, you'll get updates, information on new resources and when they're dropped, and even some educational opportunities. So the link will be available on this website. So you'll click the link, enter your email address, and select Medicare Transaction Facilitator under this Center for Medicare section once you get to that listserv link. And then we just want to note that there are some additional resources coming soon. We're currently working on an MTF user guide that will be available shortly to supplement some of these videos that we'll be providing to assist users with enrolling in the MTF. There will be instructional videos similar to what you just saw in the demo, broken up to highlight specific pieces on how you can enroll into the module. And if you need any assistance, there'll be a great resource. And we're also planning to put out a final version of the 835 companion guide. The initial version was put out, and we received some great feedback, and we're working to finalize that as well. When those things are available, they'll be noted in the MTF listserv and will also be put on the website. This kind of closes the main portion of our presentation, but wanted to stay on to answer a couple of questions that we've received via the MTF box recently. I'm going to turn it over to Brennan to go over the first question that we had received.
Thanks, Mike. We've gotten a lot of great questions into the box, as Mike said. One, this is just a general theme of questions, but as a pharmacy, do I need to enroll? Why should I enroll? How can I possibly make an enrollment decision before I know my plans with my Part D plan contract? I think a lot of general questions about this enrollment and the use of the MTF. So I want to go back a little bit to what we've been saying throughout this presentation and have said previously. The MTF will be, for pharmacies, a really central and critical tool once these maximum fair prices take effect. We've got to be able to get some data to the manufacturers. Manufacturers need to be able to, act on that data to make their decision about how they're going to effectuate the MFP consistent with the statute. And then we need a way to get that back to pharmacies to make sure we're processing those payments. The MTF is that tool. So again, once you're enrolled, you can be a passive user, but the information that we're collecting during enrollment is critical to make sure that process works and to make sure that you can receive those MFP refunds to accompany the reimbursement you're going to receive from the plan after the MFP is effectuated. So in terms of why should I enroll, that really is the key piece here. It's really an all upside tool for pharmacies. The information you're providing is just making sure we're operational and sustainable. As we talked about a little bit earlier, there's nothing about enrolling in the MTF that is obligating you to take any other actions under Medicare Part D. The user agreements, as Mike was mentioning, should cover the operations and use of the system, but do not put any commitments that are further than that or outside the system. And so again, you can enroll here. Perhaps you don't often or need to dispense a selected drug in 2026, or it doesn't happen very often in your pharmacy. Once you enroll, you're good to go. If you do happen to have one of those come through your system, you'll be set up to be able to be connected with the manufacturers to accompany that reimbursement with an MFP refund. If you don't enroll, we expect you could potentially see delays there. We won't have the information we need to facilitate that connection. And there could be a gap in getting that MFP refund moving forward. So, again, I think, the way we are thinking of this and have designed the system is really with pharmacies in mind and as a low burden, all upside tool, but a critical one at that. So definitely encourage folks engaging early, get this set up, reach out with questions, make sure we can help you out. But certainly worth taking a moment to go through this process and get your enrollment set up. Mike, do you want to take the next one?
Yeah, that sounds good. Thanks, Brandon. So yeah, Brandon's saying, why should I enroll? So now we're going to go over who needs to enroll. We've received some questions here. So for example, I use a third-party support entity like a PSAO or a pharmacy services administrative organization. Can they enroll for my pharmacy? Do all the stores in a chain need to enroll separately? Do TPSEs or third-party support entities need to enroll? So we kind of went over this before, but we know that there's a lot of organizations that use these PSAOs or other organizations that kind of take care of their accounting or financial needs and services. And people may want their payments to kind of continue to go there where they do for regular business. But the dispensing entity still needs to enroll in the system. And then the third-party support entity, like a PSAO, would need to enroll as well, right? So both sides still need to enroll in order to make that connection. But once that connection is made in the MTF, then there is the ability for a PSAO or some type of payment center or organization to be able to, receive payment or remittance on behalf of those organizations. So both organizations need to enroll. And if you're a dispensing entity, when you're enrolling, you will get the option to, potentially select one or more organizations that you work with for your financial needs. And then one other piece of this question was, do all the stores in a chain need to enroll separately? So no, for chains, if they're associated together with a chain code, an organization can enroll on behalf of the chain within the MTF. And again, if you have questions on those, you can reach out to our help desk or our email address for support. So Brennan, you want to take the next one?
Yeah. So we've been getting a lot of folks who are excited to enroll. Curious, when can we do it? How do we do it? Where do we do it? So the main question here is, when am I going to receive my invitation? Who will receive the invitation? As Mike had mentioned earlier, we anticipate beginning to roll out enrollment invitations on June 9th. These will come to the contacts from the NCPDP database. You may have recently received an email to go in and review and make sure the contact information are up to date. Definitely encourage folks to continue to do that. That is our pool where we will draw initial contacts from. So again, expect that beginning on June 9th. As Mike had mentioned, we're going to roll this out over a few weeks where we'll be sending email invites every day. So if you don't get it in June 9th or the few days after, no worries. You're likely just in a later batch. We do expect to have all of our initial invites sent out by July 1st, no later than July 1st. So if you get it early July and you haven't seen anything come through, definitely reach out. We can make sure that we've got you accounted for and can get an enrollment link your way as well. That is kind of the general when. I think another thing to note here is there a deadline after I've gotten my invitation, or is there a deadline to enroll in general? First and foremost, there's not a hard deadline on enrollment for pharmacies. It's going to continue to be open and available. We expect enrollment will continue even after MFP effectuation is underway. So there'll be new pharmacies coming online that need to get set up on the system next year, for example. That said, we absolutely encourage taking action sooner than later, making sure everything is squared away and set to go. Again, get in the system. You don't have to think about it. It'll be ready for you in January when you need it. One thing I will flag is the invitation will have a 72-hour expiration date on it. And this is a system security protocol to make sure that the links are staying fresh and where we need them to be. So if you get an invitation, you can't get to it within 72 hours. Maybe you were on vacation, something like that, perhaps just busy with your normal day-to-day. No worries at all. You just need to reach out to our help desk. They'll get you a fresh link and you'll be able to enroll there. So just to flag, if you have a link and it doesn't seem to be working, it's possible that you've reached the 72-hour expiration and you just need a fresh link. We'll be happy to provide that as well. Mike, I'll turn it back to you for some more NCPDP stuff.
Yeah, so we have received a couple of questions regarding this NCPDP data syncing piece. And again, this is kind of the key to our system to ensure that only legitimate entities are coming into the system, and we're potentially paying someone who is who they say they are, and we're able to validate that with another source. So during enrollment, what should someone do if they notice the NCPDP data synced to their account looks incorrect or out of date? So this is a great question. I think there's a couple of options here. So we mentioned earlier that you could potentially just go back to the NCPDP database, get with your organization, and ensure that your information is correct using the NCPDP online access. Making sure that primary point of contact that will function as that first user is up to date, and then just make sure all your other information, company information is up to date as well. And then you could wait, about 2 weeks to ensure that that refreshed information came through on our NCPDP feed. So the next time you went to enroll and wanted to use that pre-populated NCPDP information, that it was showing up correctly in the enrollment module. Or if you didn't want to wait, there is the option to not accept that initial information or that pre-populated information, and you could manually submit your information there. I think either way, we think a best practice is to have the NCPDP up to date for a variety of reasons, but you would have the ability to kind of manually select and put in whatever information you felt was appropriate for your organization there. So yeah, and Brendan, I'll pass back to you.
Great. Lots of questions have come in about the user roles. What are the user roles? How many can I have for my organization? Things like that. So I just want to talk a little bit about addressing that area. Generally, I think as folks know, and we saw in the demo, there are 3 distinct user roles for pharmacies: a signatory role, an access manager, and a staff end user role. We do have limits in the system to how many individual team members can be assigned to each role. For the signatory official and the access manager, it is 3 each. And for the staff end user, it is 10. So 16 total users for an organization. And that is, again, a protocol to maintain some system hygiene. I think one of the questions we often get is, can one of my team members have more than one role? Could they be a signatory and an access manager, for example? What I would highlight here is the way the roles are set up are a system of cascading permissions, such that the signatory user can do everything the access manager can do and the end user can do, but they can also authorize your organization by signing the agreements. The access manager, they can't do signatories, they can do everything that the staff end users can do. The staff end users have the most limited permissions. So under the structure, there's really no purpose of having one person in more than one role. The key is just assigning them to the right role so that they have the permissions that you need them to have to operate. And again, recognizing with the limitations on the number of users with staff churn and things like that, that you could bump against those boundaries. But what we'll note here is that as an end user, both the access manager and the signatory user will be able to add new users, remove users, update user roles. That's all in your hands as a system user. So you can do it on demand whenever you need to switch folks out. You can invite new people in your organization, whatever you need to, once you've established your account with the MTF. So trying to put as much flexibility as we can in your hands as the user to make sure that can be operational in the long run too. Mike, I'll pass it back to you.
Yeah, thanks, Brendan. And then another question, which was talked about a little bit in the presentation, but when enrolling, what kind of flexibility do I have for using my third-party support entity or PSAO or something else? Do I have to use them to receive both payments and remittance advice, or can I use them for one or the other? And again, this is where we were trying to provide some flexibility. So there will be the ability to designate a different entity for payments and or remittance advice. So, as you know, there will be remittance advice required for payments that come through the MTF, whether that's electronic or some type of paper remittance. But for electronic remittance advice that we would be sending for manufacturers that are opting into the payment module, there will be a location in the system where those feeds will come through, and that could be a different entity than where the payments are being received. So, for example, your dispensing entity could receive the payments to your own address or headquarters, and you could have the electronic remittance advice going somewhere else, those 835s for accounting or financial reasons, or maybe both payments and electronic remittance advice could go to the to a third-party support entity, or both could go to the dispensing entity. So we did leave that flexibility open. You could add 2 different organizations or yourself as one of those options, where you would receive the payments or the remittance advice. And again, we can help answer questions with that through the help desk if your organization is kind of confused or not sure how to set that up during the enrollment period. And then Brennan, I think I'll pass it back to you for the last question that we had recently received on the MTF.
Yeah, great. And this is an important one too. Just general interest in system security, sensitive information, data confidentiality, things like that. So obviously the MTF is going to house some sensitive information. We recognize that. We've built the system to meet the standards of federal privacy security standards. These are things like the Federal Information Security Modernization Act. The system has been tested through an authority to operate process. This includes things like penetration testing and just reliability testing, things like that, to make sure that it will operate within those standards and meets the data security standards of a federal IT system. Further, this is another piece of our enrollment process. You saw in the demo, we have a identity management process that is the very first step of enrollment. This is making sure that only the right people get access to the system and are able to set up accounts. And we know it's the people who are aligned with the program, either from a manufacturer, a TPSC, or a pharmacy. We won't have additional users in there, and we've set up processes to make sure that is the case as well. And of course, this is all a function of that MTF user agreement that we talked about earlier. That for all parties involved, CMS included, it outlines what can be done with the information in the system and what cannot be done with the information in the system. How does it need to be safeguarded? This is something obviously CMS takes very seriously, and again, recognizing that you're putting some sensitive information into this system, and we're committed to taking those safeguards and making sure that data maintains secure. And with that, we'll wrap up our session for today. Please continue sending in those questions to the inbox that we had up earlier. Monitoring our resource page, you can also find some ways to get questions our way that way. And monitor the FAQ document that we'll put out regularly as well. But your questions are super helpful. We're here committed to get answers back to you and make sure this process goes smoothly, both through enrollment and through MFP implementation. As Dr. Oz said at the top today, we see pharmacies as a key partner in implementing this program successfully. We can't do it without y'all. We're looking forward to being there to work with you along the way. Anything you need, please don't hesitate to reach out. And our teams are ready to go to make sure this works. So with that, we can wrap up for today. Thank you all so much for taking the time. We look forward to working with all of you, and we'll keep an eye out for any questions or follow-ups.